All right, good morning, everybody. Thank you for joining us on this beautiful Monday morning. My name's Pete Harckham. I chair the Senate Committee on Alcoholism and Substance Abuse. I'm so honored to be joined by my colleague, Linda Rosenthal, who chairs the Assembly Committee on Alcoholism and Substance Abuse and has just been doing amazing work in this field for years now. So I feel honored to serve with her. And also joining us is an old colleague and old friend, Tara Martin, the state political director from the New York State Nurses Association. So today we're here to talk about a bill which will be on the floor of the Senate this evening for a vote, and sponsored in the Senate by me and the Assembly by Assemblywoman Rosenthal. And it's a very simple bill. You know, we had nurses come to us and in the course of their daily work, they get a prescription for opioid blockers like Narcan or naloxone, so they can treat patients either in hospitals, in schools, or they can carry it with them in public in emergencies that they happen to come upon. And what happened was when they went to apply for life insurance, it showed up on their list of prescriptions, and they were being denied life insurance because of this prescription that they carry to help the public. And that's discrimination that we can't tolerate. We need to help everybody we can in the fight against opioids. You know, there's no magic bullet. We cannot wave a silver wand to end this crisis. So we do it in a patchwork fashion, and this is one of the fixes, is protecting our nurses who are on the front lines of this crisis, and that's what this bill does. So with that, it's my pleasure to introduce the chair of the Assembly Committee on Alcoholism and Substance Abuse, Assemblywoman Linda Rosenthal.
Thank you so much, Senator, and thank you for leading on this. A small correction, my committee is called drug abuse, not substance abuse, although I would rather it be called substance abuse because that's actually a better title. But, you know, the insurance industry is one of the hardest industries for us to regulate and for us as state legislators to force to do anything. I've had other examples where if a person takes PrEP and PEP prophylactically so they don't get HIV transmission, the insurance industry will say, well, we're not going to cover you because you have risky behavior. But no, they are preventing risky behavior from having an effect. So it's really backwards. And I think for the insurance industry, it's another way to collect money but not have to pay it out. And, you know, this state, the governor, the legislature has been all about making sure that naloxone is available everywhere to anyone who needs it, either for themselves or to help save a life. And the fact that the insurance industry would just do the opposite and say, if you carry this life-saving tool, we're going to punish you. I mean, that doesn't make sense even in a topsy-turvy world. And that's why I'm so happy to be working with Senator Harckham to change this dynamic. It's just ridiculous. It's another money grab. There's no basis in fact. There's no reason to deny people life insurance, especially nurses who put their lives and their health on the line to do their utmost for their patients. It's just something that we have to fix, and I'm confident we are going to fix it because it's just another stupid rule perpetrated on the medical consumer in New York State.
Thank you.
Thank you.
Tara?
Good afternoon, everyone. My name is Tara Martin. I am the statewide political director for the New York State Nurses Association. We are the largest labor union and professional association representing registered nurses in the state of New York. We have 42,000 members from Buffalo to Brooklyn, and it's our honor to be here today with Senator Harckham and Assemblywoman Rosenthal to endorse this piece of legislation, which is very vital to our members. Nurses are on the front lines of every type of healthcare disaster, whether it's Ebola affecting our patients, whether it's the opioid crisis that's happening across the country. Nurses are in the front line. We see these patients come into our emergency rooms and we treat them because the oath of a nurse is to do no harm. So the goal is, while we are operating and doing our job, which is a calling on behalf of all of us, we are trying our best to also stay safe while we are administering this care. And the fact that we have life insurance companies that are willing to not not cover us because of our ability to stay safe at the job is reprehensible and irresponsible. We are asking as the New York State Nurses Association that this bill be passed, not only to protect current nurses who are working in the field, but some also student nurses, which are here today. We have a bunch of different student nurses from all over the state that are here to not only fight for the practice, but to make sure that we are providing the best possible health care for the people that we represent. So we're very thrilled and happy to be here joining with you all. This is also the first day of National Nurses Week, so thank a nurse this week. So at the end of the day, we are just thrilled to see this bill pass, and the nurses, all 42,000 of us, are at the ready to be there to help to move this legislation forward, because it is very vital to us and it is vital to our patients. So thank you all for joining.
Thank you.